Could you also get us some masks, please?
Namaskar, hello, welcome to this channel. This video is in response to the widespread panic coronavirus has caused all over the world. You know, times are tough when toilet paper goes out of stock in UK and every Ram and Rahim in India wear surgical masks. My own family is on tenterhooks and falling victim to the spread of fake news and views on WhatsApp. But COVID-19 is not the only infection in town, mind you, and definitely not the deadliest one. I'm a doctor. I work in hospitals, which is literally where all bugs come together. I did my medical training in public sector hospitals in India in some of the most overcrowded and infective settings. From the big guns like tuberculosis and HIV to small fries like malaria and typhoid, you name it, I've seen it. I've been involved in caring for patients with some of the most communicable diseases known to man and still do in my current hospital in London. Being in such a high-risk environment all the time has made me conscious about protecting myself so that I don't fall sick, I don't carry it home and let my loved ones suffer, and also I don't transfer infection from one patient to another. I have been keeping myself up to date with World Health Organization reports and recommendations on COVID-19, and whatever they have asked us to do, I do them anyway. So even though this video is triggered by recent events, it is about everything I do in my life to keep infections away, and I've been doing this for many years now. Now before I proceed, here's a quick reminder to subscribe guys, it's really very easy. The first step in avoiding infection is of course prevention. I will start with washing hands as that is the most spoken about subject today. I'm in a surgical specialty and we are required to wash our hands before and after seeing every single patient. Before we go for operating, we thoroughly wash our hands twice, each lasting for 2 minutes. Now one really doesn't need to be that obsessive in a domestic setting as long as it is done properly and enough number of times. Mind you, I'm a good host, but not to germs and have well laid out ground rules that Vikram and I follow with military precision. First of all, when we come home, we take off our jackets and shoes and head straight to the toilet to wash our hands. Washing hands are also mandatory before and after cooking, before and after eating, and obviously after using the toilet for any reason. That's a no-brainer really. Ladies, very important to remember to wash your hands before you wear makeup. I will wash them afterwards too, but I'm a little bit too crazy about cleanliness. Also, I quick clean my makeup brushes with the spray after every use and deep clean all makeup tools every few weeks. Laptops, keyboards and smartphone screens can also house germs, so just remember to wash your hands after you press the subscribe and like buttons and leave a nice little comment for me. When we are out somewhere, we also follow the same hand washing protocols as we do at home. We are Indians and must shower every day. I used to do it in the morning, but now I shower after returning from after returning from work, whenever that is. Germs can also land on items of clothing. In my household, one is not allowed to sit in bed wearing outside clothes, and that includes clothes that have been worn to the gym. All my workwear, including socks, are kept in a segregated area of the wardrobe, and I do not wear them to any other place. I have designated work bag too, which is stored separate to the other ones, and every few weeks I will deep clean it. Both of us take public transports to work and often our backpacks are kept on the train floor. Obviously, I do not allow them in bed. In fact, apart from my fancy handbags, no other bag is fortunate enough. I prefer to wash clothes at 30 degrees centigrade to save energy unless they are my work clothes and are innerwear. These usually have more germs and are washed at 60 degrees centigrade. Towels and bed linen are also washed at 60. Towels are changed every few days depending on usage and bed linen on the 1st and 15th of every month. Remember the military precision I was talking about? The flat is cleaned at least once every week, which includes dusting every corner along with the skirting, sweeping and mopping the floor. Twice a year, it is also deep cleaned. If you know me or have been following me on social media, you will probably know that I love to travel and I'm not going to cancel my travel plans. I will though stick to the travel hygiene rules I have been following all these years. On returning home from a trip, I stop at the door. All unpacking is done, keeping the luggage on the floor. As you guessed it right, it is not allowed in the bedroom. Clothes are sent for washing straight away. That will definitely include whatever I wore for the journey. Every few trips, the travel pillow and backpack will also go for a wash. This time, my shoes went to the washing machine too, as it was a work trip and I had worn this pair in the hospital. Another thing that I diligently follow is to have a thorough shower with hair wash after every flight. Now this may seem like a lot, but believe me, if you have a little bit of discipline, it really is not difficult.
Wait, could you get us some masks from your hospital, please?
Imagine this. You have a mask on to prevent droplets from reaching your nose. But germs from other people can settle on your clothes, shoes, bags and hair. And these can enter your body through your eyes and even nose from the tiny little cap in your mask. Healthcare staff like me looking after COVID-19 patients use proper size masks. And believe me, it takes time for the fitting to take place. We need it because we spend a long time in close proximity to infection and not just share a tube ride or a bus ride with someone who may be infected. WHO recommends wearing masks only if you are caring for someone with COVID-19 or have cough and sneezing. Standard masks do not offer full protection from infection reaching your system, and unless you are trained, you will not know how to properly use and dispose of a mask, which can be counterproductive. Doctors and nurses wear masks only when needed and along with other protective gears like caps, visors, scrubs, aprons and shoes. Wearing only a mask without the others will be pretty useless, don't you think? Regular hand washing and avoiding touching your face are the primary precautions one needs for a day-to-day life. Now, prevention is not just restricted to your environment. Remember, the body is the primary line of defense against any infection, and I strongly believe in optimizing health. When I was in first year of medical college, a couple of seniors had contracted tuberculosis from patients. I remember one of my teachers explained how low blood sugar makes the body prone to infections. From that day, I made it a point of not leaving home in an empty stomach, no matter how early it is. Even if it is 4 in the morning, even if I'm late, I will always have a full breakfast first. Along with a balanced diet, we also regularly exercise. As a healthcare worker, I have had a lot more vaccinations that Vikram did, but every year before winter sets in, we go for annual flu jabs. Now, despite all precautions, infections can still happen. That is how our human body works. We all fall sick at some points of our lives, and that's how our immunity is built too. Thankfully, most infections are self-limiting and only need good nutrition and hydration. In fact, most patients suffering from COVID-19 have also recovered or are recovering. So seek help if you are concerned, but do not panic. Look for online resources from authentic bodies like WHO, NHS and CDC for more information on individual diseases. And just for your information, coronavirus is not a new infection. It is a family of virus that has been around for generations. COVID-19 is the newest member, but there are less severe forms too. That includes a kind called canine coronavirus, which can cause deadly diarrhea in dogs, which is not transmitted to humans. Dogs should be vaccinated against it for their own safety and not because, and I repeat myself here, there is any risk of that infecting humans. There is no evidence that domestic animals like dogs and cats transmit COVID-19, and the risk of them being infected from humans is also minimal. I mention this here as wrong information on this is being circulated, and unfortunately, some innocent animals are having to bear the brunt. So stay safe, stay healthy. Remember, information is key, but only when it is coming from the correct source. Bye.